So the second wave is behind us. Infections, admissions and COVID deaths are dropping, and we're now on level 1. At the same time, the vaccination program is starting to pick up speed, but there's still a long road ahead, and it is a race against time. I'm joined now by vaccinologist and director of the Vaccines and Infectious Diseases Analytical Research Unit at Wits University, Professor Shabir Madhi. Professor, thank you so much for joining us. We have seen in the past year, as soon as restrictions are eased, we tend to forget that there's a pandemic. Do you think it was wise to move us to level 1 a month before the Easter holidays?
So good evening, Sally. So, Sally, I think the approach that we use this time around is a bit more measured than what occurred in August, September last year when we went into level 1, and in particular in relation to mass gatherings. So there are still restrictions that have been placed on mass gatherings, and that probably was one of the major reasons why we experienced massive resurgence as we did in November of last year, together with the evolution of the virus. So provided that we do not allow for massive mass gatherings, I think we've got little choice other than to open up the economy and to allow people to continue with their livelihoods to survive. So I think it is a more measured approach than what occurred the first time round when we went down to level 1.
At the same time, though, there's no restriction any longer on the sale of alcohol. And alcohol is just a really bad combination, it seems, for us here in South Africa, because we do have an alcohol problem, and caution is thrown to the wind, it seems.
Correct. So the alcohol part of it has got two aspects to it. The one part relates to the excessive demand it places on healthcare facilities, when there's violence related to, directly or indirectly related to alcohol. But fortunately right now, we're in the space where the healthcare facilities are able to cope with additional sort of demands compared to a few weeks ago. But in addition to that, the other component of alcohol is that if it is consumed indoors, especially in pubs, clubs, shebeens as an example, under those circumstances, it could very much lead to super spreader events, because obviously your behavior is very different under those conditions. So there's two aspects to it. But again, I think there's very little choice other than to prohibit alcohol till the end of the pandemic, which is unrealistic for us to take these steps. But hopefully the citizens would be more responsible in terms of consumption of alcohol.
At the same time, vaccine rollout plans are gathering pace. We are going to have to ramp up massively. The Health Minister explaining that the plan is to ramp up extensively by April. But at the moment, we've done 70,000 jabs in 10 days. We're going to have to do surely a couple of 100,000 every day for it to make any difference at all before our second wave, which is likely to hit May, June. Can we do it?
So the short answer is no, because as the President announced last night, in all likelihood, we'll only be getting substantial quantities of vaccine around about April, May, which means that we'll be vaccinating through the next wave, essentially the third wave. So it's unfortunate, but it is what it is, simply because of the demands when it comes to COVID-19 vaccines. We obviously need to be careful in terms of extrapolating with the current experience with healthcare workers, because this vaccine is being rolled out as part of an implementation study. So it doesn't really speak to what the resources might be available and what platforms might be available when we need to go into the public to start vaccinating. But it is going to be a huge challenge. And in fact, it serves our purpose right now to already start booking people from the middle of April onwards and to really focus on those individuals that are at high risk of developing severe disease. Because it's no longer a question of us getting to herd immunity with vaccines. It's unfortunately not going to happen with this first generation of vaccines, especially in a country such as South Africa, where this variant that is circulating is resistant to most of the vaccines, at least when it comes to mild infections.
Where are we with, I know that the AstraZeneca vaccine didn't do as well as was hoped with the 501YV2 variant. Has there been any further updates? We've heard some good news, obviously, about Johnson & Johnson and its ability to combat this variant dominant here. Also, good news on Pfizer. Can you update us on any other vaccines, including AstraZeneca, if there's any new information there?
Well, the vaccine that, in fact, has got the most robust evidence that it would actually work against a variant, including the full spectrum of disease, mild, moderate, and severe disease, is a Novavax vaccine, which we evaluated in South Africa, for which the vaccine efficacy was 60%. In fact, the Pfizer vaccine, in all likelihood, will have similar, if not lower, efficacy than the Novavax vaccine based on immune responses that's induced. With the Johnson & Johnson vaccine, it's a vaccine that specifically really protects against moderate and severe disease. And we're still not too sure about how well it is going to perform against the same spectrum of illness, which the AstraZeneca vaccine failed to protect against. Which also does not mean that the AstraZeneca vaccine doesn't necessarily protect against severe disease. And I think it's important for us just to unbundle those sort of issues which usually gets lost when just looking at one specific number that is being mentioned. So we do have vaccines. These vaccines, probably all of them, will likely protect against severe disease and death. But when it comes to mild infections, which is really what drives the resurgence, these vaccines generally will be less efficacious compared to how well they would have performed against the original virus that was circulating in South Africa.
A lot of people, after hearing about the level 1 restrictions, are saying, that's great, I'm still going to live as if I'm on level 5. Do you think that's a good strategy?
Well, I wouldn't live like I'm in level 5, which means you would pretty much need to lock yourself indoors. Like I said, the reality with COVID-19 that we need to start coming to grips with is that COVID-19 is not going to disappear in our lifetimes, essentially. It's going to be an illness, it's going to be a virus that's going to be around, it's going to be causing illness for decades to come. But it's really minimizing the number of people that end up in hospital and that die. And that is where the vaccines really play a major role, in that these vaccines have got 80% to 100% efficacy in terms of reducing the risk of individuals ending up in hospital and dying. And so I think we need to stop believing that the virus is going to go away, even when we do have vaccines. And even if we were to vaccinate 40 million people in South Africa, the virus is not going to go away. COVID-19 is here to stay, and it's really to try to minimize suffering from the virus.
Very quickly, you said there's no way that we can have enough people vaccinated to make any impact on a likely third wave around May, June. What might be the situation towards the end of the year? Could we see our vaccines having an impact on the illness by then?
So I think there might be some impact come June, July, but it really depends how quickly we're able to roll out the vaccine once it becomes available in April and who we target for vaccination. And then beyond that, it partly depends on the amount of vaccine we get, how efficient we are with the vaccination program, and it also depends on the virus. Unfortunately, if the virus undergoes another round of mutations, making it even more resistant to the vaccines, then we're in a very different space than if this virus were just to remain a bit stable and for us to get our vaccines into the arms of people.
Well, thank you very much. Very sobering news, but important information. And thank you for always levelling with us on where we're at regarding this virus. Vaccinologist and Director of the Vaccines and Infectious Diseases Analytical Research Unit at Wits University, Professor Shabir Madhi there.